Welcome to this edition of Tahoe Talk. We're joined this week with Dr. Stephen Tann. Dr. Tann, thanks for taking time to join us. You're with the Carson Tahoe Cardiology Department at the Carson Hospital down in South Carson.
Correct, yep. Thank you for having me.
Give us a little overview for some of our guests. I know we have a lot of visitors here from the Barton Hospital. Tell us a little bit about your department and the hospital.
Well, I am a part of Carson Tahoe Cardiology, and we work hand in hand with Carson Tahoe Hospital. It's a relatively new, beautiful, state-of-the-art hospital in Carson City. We have 9 members in our group, but we've also got a full complement of physicians assistants, nurses, clinical services, and in the hospital we do procedures, we do interventional work, we do pacemakers and angioplasty and invasive treatment of heart disease, as well as preventative medicine, which we do primarily in the outpatient setting.
Sounds like the science has evolved quite a bit, you know, in the area of risk of heart attack for men and for women. What are some of the new treatment options that you have available at the hospital?
Well, if we're talking specifically about coronary heart disease, which is blockages in the heart arteries, which is the most common form of heart disease in this country, there are a lot of different treatment modalities. First of which is medical treatment and modifying people's risk factors, controlling things like blood pressure, diabetes, smoking, to help prevent events from coronary heart disease. But once it's gotten to the point where actually you need to step in and treat to either improve symptoms or to actually stop a heart attack, there's a couple of different treatments. There's percutaneous coronary intervention, which is what I do. That's a non-surgical means for opening up blocked arteries. And then there's open heart bypass surgery, which we also do at Carson Tahoe.
Is that partially where they insert an inflatable balloon within the veins? And
it actually goes into the arteries. Yeah, we have different approaches. The traditional approach has been through an artery in the groin, and you make your way up to the area around the heart and use wires and balloons and a tool called a stent to get blockages open. More recently, some of us at Carson Tahoe have adopted a technique where we go through an artery in the wrist, which we think is certainly more comfortable but also safer for the patient in terms of potential risks. So yes, the bottom line is you get into an artery that will get you to the heart, and we have tools then that we can get in and open up blocked arteries. And then the backbone of what we use is a stent, which is a strut that will keep the artery open and actually deliver medicine to the blockage to keep it from coming back.
Symptoms are often different for men and for women, depending on age and whatnot. If someone's looking for a checkup or they have some concerns, what's the best way to get a hold of you or someone on your staff?
Well, we've actually got a very nice website, which is on Carson Tahoe Hospital's website. We have a web page, and it's got all of our contact information. Probably easiest to go there because not only is there the way to contact us, but there's a lot of helpful information about starting to ask the right questions about one's risk, about one's symptoms, what treatment options are available. So any and all information that I think patients would need, they could find there.
Well, you certainly have a beautiful modern facility down in Carson. It's a very short drive here for folks in the Tahoe, either North Shore or South Shore. Where are we going to find you this weekend or any given weekend here in Lake Tahoe?
Depends on the time of the year, but it's up around the lake somewhere. If in the cold months, it's very likely you'll find me up on Heavenly or at Squaw.
Dr. Tann, I appreciate you taking the time to join us.
My pleasure.
All right, that's going to do it for this edition of Tahoe Talk. We'll see you next week.